Hi, so today we're going to be talking about chronic obstructive pulmonary disease, or COPD. I'm Michelle Leung, and this is Wesley Kong.
So today's topics, we're just going to go over what do you have to know about COPD? What is it? What are some of the risk factors? What symptoms can you look out for? Myths and facts. How do we diagnose COPD? What are some treatment options? And overall, what can we do to manage COPD?
So there are multiple reasons why you need to know about COPD. Some of those reasons include women are 37% more likely to develop COPD than men. Women are twice as likely to be diagnosed with bronchitis than men. And COPD is the third leading cause of death in the US. And 12 million Americans live with COPD. So we're going to be bringing in Esther, who's going to be fielding questions from the audience about COPD.
Yeah, thank you. So may I ask, what is COPD on behalf of the audience?
Well, COPD, or chronic obstructive pulmonary disease, refers to really a group of diseases that cause airway blockage. So it's divided into chronic bronchitis and emphysema. Specifically, chronic bronchitis is where you have a lot of mucus buildup within the airway, and that makes it a little difficult to breathe, some inflammation there, versus emphysema, which will cause damage to the air sacs within the lungs.
So I have a patient that does not smoke. Why do they have COPD?
Yeah, so you're right. Tobacco smoking is a big risk factor for COPD, but there are also other risk factors. For example, outdoor air pollution, indoor air pollution, occupational risks, and asthma.
I see. So how do I know if this patient has COPD or not?
Well, generally, there are a few symptoms to look out for. They might cough or they might have a wheeze. Additionally, when they cough, they might have some phlegm that comes up. We call that a wet cough. They might have difficulty breathing as well.
I see. So I thought COPD only happens to elder patients.
Yeah, so you're right again. People in their 50s and 60s are often diagnosed with COPD, but it can actually begin as early as 20s.
So I also thought COPD only affect the lungs. Is that true?
Right, so COPD does affect the lungs, but it could also affect other parts of the body. For example, your blood pressure may increase, so that could increase your risk for heart disease as well.
So should the patient avoid exercise since they have difficulty of breathing?
Yeah, so shortness of breath can make it more difficult to exercise, but exercise is actually a really important part of managing COPD.
So what happened after the diagnosis?
So although there isn't a cure for COPD, we have treatment options that could help manage the symptoms. Overall, it could help improve the quality of life for the patient.
So how is COPD is diagnosed?
Yeah, so spirometry is one of the most important ways of diagnosing COPD, and all that means is that you breathe into a machine, and that checks your lung function. And you can also use pulse oximetry, which checks your oxygen levels, and you can use CT scan for imaging of your organs.
So how can we do it?
So there's a regimen of different medications that can be given to treat COPD. Typically, you might be given an inhaler for the lungs, or you might take an oral medication. There could be like a combination of both, depending on the severity of the symptoms and your risk factors.
So is there a vaccine for COPD?
So no, there's no vaccine for COPD, but that's an important part of managing COPD. So for example, you can take the flu vaccine or pneumonia vaccines. And this is especially important for people with COPD because COPD can make you more susceptible to these infections.
On top of the vaccines, in order to help with the symptoms, you might be given some oxygen therapy, so some supplemental oxygen that you could take at home, perhaps, to help manage the symptoms.
And if your COPD gets really bad, you can do surgery. So for example, you can do lung volume reduction and remove the damaged lung tissue, or you could do lung transplantation and get a new lung.
So is there anything my patient can do at home?
Well, if you recall, we were talking about some risk factors that cause COPD. An important thing is to reduce those exposures. So perhaps if your COPD might be coming from smoking, it's important to stop smoking. That includes secondhand smoke. Alternatively, there's air pollution indoors and outdoors that you could try to limit your exposure to. And if you work in some occupations, you might be exposed to dust and fumes that way, so it might be important to wear a mask to help limit your exposures. On top of that, you should be regularly seeing your doctor, and again, physical activity could help with your symptoms.
And another important part of managing your COPD is diet. So for example, you can eat more good fats such as avocado, olive oil, fish oil, nuts, and nut butters.
You could eat some certain proteins. So we have some beans, milk, eggs, and again, nuts or almonds.
And you should avoid fast foods and fried foods or sodas.
And lastly, you want to stay hydrated, to drink lots of water, and that could help thin out the mucus so it's easier to cough up.
Excellent. Thank you so much for your explanation. Now I know how to better treat COPD if patients have COPD.
Great. Thanks.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like and subscribe to our channel for more related content.